All right, welcome back to the Advanced EMT. Of course, like always, we're using the Pearson uh, book, the Advanced EMT, a clinical reasoning approach, the second edition, the updated version. This is the latest version out as of this video. We're talking about Chapter 7, which is medical terminology. All right, so like I explained before, a lot of this you've seen in the past. This is just going to be a build up from your EMT class. So a lot of it's just going to be a review. A lot of it we will build upon as we go further into the chapters, right? So medical terminology, it got its roots from Latin and ancient Greek. That's why sometimes it's kind of hard for us, is because it's from Latin and ancient Greek. It uses common prefixes, a root word, and a suffix. We use common symbols sometimes. We can abbreviate, and we have different ways of writing numbers as well. It starts with a root word. This is the meaning or the foundation of the medical term. It's the root word. Uh, and then it builds from that. We add a prefix to the beginning of the root word and it modifies the meaning. A suffix will be placed at the end of that root word and it'll also modify the meaning. Now, a combining vowel connects root word to a suffix, or it can combine two different root words. Here's some commonly used root words with combining forms. I'm not going through all of them. We will hit some of the big ones like cardio or cardii, which is cardio, which means heart. Gastra means stomach. Hema means blood, and so on and so forth. These are all in your book, and it would be a good idea for you to study these. Uh, Numeric prefixes: null means none, hemo half, semi half. Una and mono both mean one, like unilateral, one sided. Bi means two, like bilateral means both sides. Tri is three. Tetra, four. Quad is also four. Poly and multi mean many. Common prefixes. We won't go through all these, they're in your book, but some of them are important, like your ante or anti means against. Ant means before. Brady, slow. Dis means painful or difficulty. So you have dyspnea, which is difficulty breathing. Epi is above. Hyper, hypo. Hyper is above. Hypo is low. This is important terminology. We see a lot with hypertension, which is high blood pressure. Hypoglycemia, which is low blood sugar. Intra is within. So, like I said, these are all in your book. It's a good idea to kind of look them over. Most of them you probably already know. Some more is macro is large, micro is many. Small. Uh, Neo means new. Para is equal or pair behind, alongside. Post is after. Pre is before, like prenatal. Pseudo means fake. Retro is behind, like the retroperitoneum. Sub is below. Supra means above, like supraventricular tachycardia. That's above the ventricles. And tachy means fast. Common suffixes. There's a bunch of them. Just kind of look them over. We're not going to go through them too much. No, we'll just, you can look at these on your own because there's a bunch of them. A lot of them you already know, right? All right. Spelling and pronunciating these words are important, right? Because if you misspell it or mispronunciate the word, it can be a totally different meaning what you meant it to be, and it could lead to patient care errors, right? We don't want that to happen. So if you don't know how to properly spell it or properly pronounce it, maybe it's better just to use common terminology, right? Uh, like epigastral pain. Maybe it's just better to say their stomach hurts, right? If you don't know what that is. So just be very cautious about the spelling and the pronunciation errors. Uh, there are different rules for how you make something plural or pluralizing a medical term. It's based on how it ends. And then we're going to try to avoid jargon or slang especially when we're talking to patients, because they don't understand the medical jargon or the medical slang. Um, Even sometimes the doctors and nurses don't. The nurses usually do, but sometimes you talk to a doctor and they don't, especially if they're new to the ER or whatever, they may not know what our jargon or our slang in the field means. So try to avoid that. Uh, Here's some rules for how you make a word plural. Like I said, these are all in your book. You can look them all up. Anatomical terms. These are terms of position and direction, which helps us all quickly identify an area of the body. Um, Use of an anatomical position and body planes are points of reference, and always use terms that relate to tissue. We also use tissue, organs, body, and cavity regions, terms that relate to those. Like here's terms of position, right? As you see it right here, it says midline. That's the middle of your body, right? Distal, proximal. That's proximal means closer to the core or the body. Distal means farther away. Palmar is the palm of the hand. Lateral is to the side. Medial is to the center. When we're describing something, that's the patient's left and right, not ours. Posterior is the front. I'm sorry, the back or dorsal. Anterior or ventral is the front. Mid-axillary line is the one that runs through your armpit and splits you front and left. I'm sorry, front and back. Anterior means top, inferior means below, or superior could be. I'm sorry, superior is top. It means so if someone's your supervisor, they're above you, right? And if someone is more inferior, they're below you. This is the anatomical position, standing facing you with palms forward. When we hear the anatomical position, this is exactly what we're talking about. Different body planes can split the body, like a frontal plane will divide the body from front and back. The sagittal plane runs down the medial line, so it divides it left and right. And the transverse plane divides upper and lower. Terms referring to body cavities, like cranial cavity, that's where your brain. Your spinal cavity, where your spine. Thoracic cavity is your chest, right? Your abdominal cavity is, of course, your abdominal area. Abdominal pelvic cavity is both your abdominal and pelvic, and then your pelvic cavity is in your pelvis area, right? Different directions. Ad or abduction means moving away from the midline. Add is moving towards. This is pretty easy to remember. If you're moving your arms towards your body, you're adding to your body. If you're moving away, you're abducting. Anterior towards the front. Apex is the tip of a structure, like the apex points of the apex of the heart points downward. The base is the lower part. Caudal means towards the tail. Then humans, this is feet. Uh, some of these, like deep, is inside the body. Distal is away. Dorsal is towards the back. Extension is straightening of a joint. Flexation is bending that joint. Just remember, like flexing your bicep. Inferior is below. Lateral to the side. Medial is towards the middle. Midline is exactly what it says. It's right in the middle. Dividing the body into equal left and rights. Posterior or dorsal is the back. A different position. Prone is laying face down. Proximal is near the midline. Superficial is towards the outside surface. Superior above. Supine is laying on your posterior or back. Ventral is towards the front. So proper patient position can reduce pain. So prone, that's on their belly, right? A left lateral recumbent would be laying on their left side. Right would be on the right side. Supine is their back. If someone is positioned in a Fowler position, they're almost sitting upright. And the semi-Fowler is kind of leaning back but not laying flat. And we're going to use these tables in your book for body systems that particular terms associated with it: the musculoskeletal system, the cardiovascular, the body and immune system, respiratory, gastrointestinal, and the nervous system. All right. Common accepted abbreviations. These are nice to know. Like an A with a line above it means before. A C with a line above it means with. NTG is nitro. O2, of course, is oxygen. OB is obstetrics. A P with a line over it is after. PE is physical exam or pulmonary embolism. PO means by mouth or oral. PT, of course, is abbreviation for patient. Q with a line over it is every, like 15 milligrams Q4. That's 15 milligrams every 4 hours. QID means 4 times in a day. R/O is roll out. RX is prescription. S with line over is without. S/S is signs and symptoms. SID is sudden infant death syndrome. SL is sublingual, which is where, right, under your tongue. SOB, not what you're thinking, is shortness of breath. STAT means immediate. S with an X is symptoms. TIA is transient ischemic attack. TID is 3 times a day. TKO is keep open. X means times. Y/O is years old. The arrow up means increased. Arrow below decreased. We use some common abbreviation used for charting. Patient, we can use this as patient information and categories. We can use abbreviation for body systems, common complaints, diagnoses, medications, anatomy and landmarks, physical exam findings. We can use for miscellaneous stuff, for treatment, for medication administration, and cardiology. And that's in your book on table 714 are some commonly used abbreviations. Now, going back to abbreviations, one, you want to make sure that the place or your company that you're working for allows it. A lot of places don't want you to abbreviate at all. And the second one that I can recommend on abbreviations, if you're going to use abbreviations, use them throughout your career so that you will remember what they mean, right? So if you have to go to court 3, 5, 6, 7 years from now, you'll know what Y/O means. Chapter summary: unique language identifies particular profession used by its members. Proper use of medical terminology, symbols, and abbreviations require all healthcare providers. Medical terms identified by common root words, a prefix, and a suffix. Use proper terms, proper spelling, and accepted symbols and abbreviations. When in doubt, use medical dictionary to confirm your meaning. It's easy now. We don't have to carry around this big medical dictionary. You can download apps on your phone and use this quick references. If you cannot find clarification, just use plain language to express your ideals. All right, so that's chapter 7, medical terminology. Like I said, probably nothing a whole lot new to you, but we will be building as we go further in each chapter on this. So we will see you in chapter 8.